And we're back with Dr. Pei. So Dr. Pei, can you let us know what made you decide to make your career studying this condition? Why is it so important to you that research is done in this area, and how did it come about?
So it was really a chance, kind of by chance, that I become a researcher in polycystic kidney disease. I was originally trained in clinical epidemiology and actually research in glomerulonephritis, and work with Dr. Dan Catron, who is quite well known in the Canadian Society. And then I, as a junior staff, took a sabbatical, and one of my friends suggested I maybe learn something about human genetics. So this was in 1995, and I worked in Dr. Peter St. George Hislop's lab in Toronto. He's a very well-known researcher in Alzheimer's genetic disease. And I bring a kidney project to his lab, and at the time, the PKD1 and PKD2 genes were first sequenced. And so I worked on that project. And that year was very interesting and informative, and to such an extent that I decided to spend a second year with him. And then since then, I kind of refocused my effort on inherited kidney disease with a main focus in autosomal dominant polycystic kidney disease.
I think I can speak for the community where we can say thank you to the person who thought that you should learn something about genetics, because we've been so lucky to have you in the community working towards finding out more about how polycystic kidney disease works and helping patients to be involved in their care. On that note, I'd really like to discuss the Center for Innovative Management of Polycystic Kidney Disease. Could you explain to us what this center is and what it does?
So that is a center that I started around 2015. Again, it's also by chance, because a lot of things we cannot anticipate, but it was built on the foundation of the hereditary kidney clinic that we've started about 20 years ago at Toronto General, that focuses on the care of patients with inherited form of kidney disease, but of course polycystic kidney being the most common. So 2015 marked the first time we have a drug called tolvaptan, which had undergone subsequently like 2 major clinical trials and approved for use to treat and slow down the progression of autosomal dominant polycystic kidney disease. Working with Otsuka Canada, which is a company that market this drug, they had been very helpful to support a service of risk assessment to allow us to use cutting-edge genetic and imaging method to define like who are the patients that are very likely to have premature need for dialysis, and therefore would be a good candidate for the use of this drug, and also how to use this drug in a safe way under a close monitor kind of a setting. And so we decided that this may be a time to develop a center that broaden beyond just kind of doing risk assessment and treating patients with tolvaptan, but also allowing us to support other community nephrologists in Toronto or Greater Toronto area, and allow patients to participate in the different kinds of research projects and novel treatment. And so with that, we were very fortunate to continue on. And so this center become formally established. I also want to add that this was made possible not just with the support of the Otsuka Canada, but with the support of my division and also the donation of several patients with polycystic kidney disease.
That's amazing. So in the center, it states that they like to or want to involve patients in what they refer to as clinical decision-making. Can you explain to us what the role is that they play once they're involved in the center itself?
Yeah, so maybe I should just step back a little bit to let you know like what, other than what we have been doing, what is our model of care. And so we are currently managing as well as co-managing approximately 500 patients from the Greater Toronto area. It's a lot of patients, but many of them are looked after by their primary nephrologist. They would come to us for risk assessment so that at least for the high-risk patient, we would try to introduce them to the concept that there are potential treatment available and they have a choice. And so we try to really engage our patients, like despite having a standard set of care kind of management guideline that we would give them, we would also open the kind of horizon to like other research opportunity, whether it's related to new treatment options or maybe research to advance new tests to improve our diagnostic capacity. So they are the one that will eventually decide on the treatment plan.
It sounds like patients are really being given an opportunity to be empowered in their healthcare decisions and are really being linked to some novel opportunities and novel treatments that are being available through this center as a additional support to what they would be receiving from their staff nephrologist. Is that correct?
Yes. So, I mean, they are most of our patients, like we do have a large group of patients that we provide primary care. So I would say about 200 patients that I would look after, but the other 300 are maybe looked after by their primary nephrologist, and they would provide their usual kidney care, and then we would give them recommendations about what other advanced diagnostic or treatment options are available and provide those options if the patient and the doctor decided that would be the right fit for them.
Amazing. We have more of our interview with Dr. Pei coming up soon, so don't go anywhere.